This is Dan Ogola, the CEO of Matibabu Foundation, who has done an amazing job in growing, in founding and growing Matibabu to everything it is today. So thank you so much, Dan.
Hello, everyone. As Diane Dodge has stated, I'm Dan Ogola. It is a pleasure to welcome everyone for today's meeting regarding intersection of medicine and mental health for rural Kenya. A little bit about Matibabu Foundation. Matibabu Foundation is a registered health NGO in Kenya, reaching out to over 200,000 population and acting with surgical intervention, with medical intervention, and with rehabilitative services. Matibabu Foundation, with the help of Tiba Foundation, who is our partner in US, has managed to build a community hospital in a community, 8-acre community donated land. And we have also managed to set up Nursing Council of Kenya approved School of Nursing. It is an honor to have everybody discuss this important topic of intersection of medicine and mental health. So feel welcome, and we'll be looking forward to hearing from your input. Thank you so much.
Thank you, Dan. Thank you so much, Dan. So my name is Diane.
You're most welcome.
And I would like to welcome you, Moso Wuti, to all of you. I'm so glad that we are all here today, and I'm going to be moderating today's session. We have some very important panelists who will be sharing for the first section, and then we will have time available for students and personnel from Kenya, partners in Kenya who would like to ask questions. We're going to prioritize those, and then we'll also take questions from folks in the US if there is time. We want to make sure that everyone understands that everyone should be muted except for those that are talking, and the first part will just be focused on the panelists. Dan and I talked about in detail what is the question that we are addressing today. And the question comes from a recent report from the President of Kenya. There was a large research project looking into the mental health needs in Kenya. And there is a great disparity between the growing mental health needs and the amount of services in Kenya. So Dan, he's always thinking ahead of time, had already hired some social workers to begin helping at Matibabu Hospital. One model that could help address this issue, especially in the rural areas, is to look at community hospitals and clinics as places where we could add mental health services that will begin to address the needs in the community. So Dan has already begun working on this, and it's potentially a model that could help expand support throughout rural areas of Kenya. So the intersection of how a medical facility, a medical philosophy, medical services interact with mental health, we all know that there's a deep interaction there. But when we actually start looking at providing some services and support for that, there are things that we need to think about within the organizational structure, within the way that we train our staff, the way that we train our nurses, and also the way that we follow up and provide system care. And most importantly, it's the way that we have interacted with our patients and their families. And for everyone on a medical team to also see that they are part of a mental health team and to be on the lookout for these issues. So that's what we're talking about today. And Matibabu is very much in the middle of growing. And that's why I just salute Dan and the team, because it's not like they're saying, hey, we're experts in this field. They are beginning this movement, and they're sharing their process. How do you take a community hospital and start really focusing on the mental health needs, which in particular is very important during this time of COVID, where communities have a lot of isolation and less support for issues like mental health. So that is the question that we're dealing with. And our first question for today, and we will, each panelist will introduce themselves as they begin the answer to their question. So the first question, we just want to look at the connection between medicine and mental health. Why is mental health important? What are the key connections between mental health, physical health, and general well-being? And we call this in the US, we call this the mind-body connection. Why is this important for all of us to be concerned about the mental health of our patients, their families, and even our staff? So I would like to start with Humphrey Onyango, who is a lecturer at our wonderful nursing school, the Mary Ann Van Dam School of Nursing.
Thank you so much. Hello, everyone. My name is Humphrey Onyango, as Diana said, and I'm a lecturer at the college, as well as a nursing officer at the Matibabu Hospital. So mental health and physical health are inseparable, and it's a concept that many times the healthcare providers tend to forget. So it is important to always look at the mental wellness and physical wellness as one, because the body is one system. So these two aspects of health are very, very much inseparable, and they mutually exist because when somebody or a patient comes to the hospital, they're likely to be coming there because of a physical complaint in the body. Let's say, for example, they have abdominal pains, or they have a headache or a backache. So it's good as a healthcare provider to know that there is a connection between that physical complaint and a mental aspect. To give an example, there are certain mental presentations that will manifest physically. For example, if somebody has depression, or an anxiety disorder, or has maybe stress, because life is full of challenges, and our coping mechanisms are different. You'll find that this mental problem, like depression, as I said, will be manifesting with a physical presentation, like elevated blood pressure, or elevated heart rate. And therefore, as a medical personnel, or as a member of the medical team, there needs to be that particular linkage in the approach. The other way is a physical illness can cause a mental problem. I'll give an example. If someone has a chronic illness, let's say HIV or AIDS infection or cancer, they are likely to have a mental deviation. They are going to have a depression because of the illness, and that is likely to affect their coping mechanisms. So when a medical personnel approaches this, whichever the category of the two I've mentioned, they have to come with that approach of incorporation of mental side and physical side, because they can never be separated. Thank you.
Thank you so much. And next we have Emmanuel Onywera. I'll let you introduce yourself.
Hey, good morning, everybody, and good evening. I'm also Ute. My name is Emmanuel Onywera. I'm a Kenyan by birth. I'm a graduate student at the University of California, San Francisco, where I'm pursuing my psychiatric NP program. When we talk about mental health, what is mental health? Mental health, according to World Health Organization and the national and international International Alliance on Mental Health is a state of psychological, emotional, and social well-being, or the absence of mental illness. What is mental illness? So mental illness is pretty much conditions that meet a diagnostic criteria. So why is mental health important? Mental health determines how we think, our thoughts determine how we feel, and our feelings determines how we behave and interact with others. So if there's a mental distortion as a result of mental health condition, it will impact how a patient relates with the provider during care that is provided. It will affect how the patient interact with the family members that are caring for the patient. It will also affect how the patient just, the care process. The presence of mental health conditions prolongs or exacerbates the already pre-existing conditions or a procedure that they've gone through. So the understanding of mental health and the importance of it is that the body and mind are in sync. And so taking care of the mental aspect of being as a greater advantage in not only impacting the physiological or the social aspect of health, but also a communal and a holistic recovery for individuals.
Thank you so much, Emmanuel. And I'm happy to introduce to you Matilda Rial. She's an MD and a specialist in mental health and is here in the United States, but's worked extensively in East Africa. So thank you.
Good morning and good evening, everyone. I am, like Diane said, Matilda Rial, and medical doctor from South Sudan, and I have been living in the US for the past 20 years in the DC area, and I've worked in communities in South Sudan in reproductive health and mental health. To add to what Emmanuel and Humphrey said, the WHO says that there is no health without mental health. The previous speakers, they have touched almost on every aspect. So I would just like to add that mental health, mental illness affects everyone at all stages, especially children. Most of the time we do forget that mental health affects children. And sometimes it appears as behavioral issues, defiance, ADHD, autism, all of that. It could appear as a child misbehaving or adolescent doing bad things, using substance. All of these are manifestations of mental health. And I will stop here for now. Thanks.
Thank you so much, Matilda. You know, you bring up a really interesting aspect, and that is the different ways that mental health appears for different age groups and genders. And also it's different in a rural area rather than a urban area. So we're talking about rural Kenya. And the question is, in what ways can doctors and advanced practice nurses, social workers, and even the nurses and the students, just everyone in the space of the community hospital and clinics, how can we improve the psychological wellness for patients in the hospital itself, feeling comfortable there, comfortable coming to appointments, comfortable when they're there to open up about things, and then also in the community where maybe there is stigma and a lack of services. And a rural area is just unique. So let's first go to, let's do the reverse order, and let's go to Matilda first on this one. Thank you.
Thank you, Diane. I think we are doing the first thing now. We are raising awareness, which is very important. If we know that mental illness exists and it could be, like you said, stigma. Some communities are uncomfortable of talking about that. So as medical health providers, and I mean by medical health providers, nurses, students, doctors, we can all be looking at the signs in the hospital. For example, if a lady comes in and had a difficult labor and lost their child, we need to talk to that person and their family of what to look for, as this can trigger depression in a person, in an individual. And a depression, we all deal with depression every day. But when we are not able to recover from it, or when it affects the way we behave around our family, or it affects our work, for us doing our work, this is when it becomes a concern. And that's what we need to look for in patients in hospitals and also at home. Thank you.
Thank you. Emmanuel, you want to follow that?
Yes. I think the best way to kind of decimate the stigma that exists, especially in rural Kenya, is number one, by kind of finding the root cause analysis. What is causing this stigma? And so the stigma is often caused by misinformation or just the myth, the communal myth. And helping both the patients and their families understand that, mental illness has an onset. There's an activating event, something happened. It's not something that somebody just wakes up one day and, and they say that, hey, I'm going to be depressed today, or I'm going to be schizophrenic today, or I'm going to be, there's some level of psychosis today. So helping them understand that this is actually an underlying medical condition, and it's something that, looking at a lifetime, maybe it was not happening before. And so for them to understand that, there needs to be high level of increased awareness. And also just the students that we have on the panel today, it is also part of this, all of us as providers or support system to educate the community as well into understanding that.
Thank you. And Humphrey, would you, maybe you would also add a little bit in the aspect of, we are a part of a community, right? So there are other people in the space who deal with mental health. A lot of people I know go to the elders when they have a need. They may go to traditional healers. They may go to their church. If we see ourselves as part of a community of support, rather than competitors, right, in giving support, how can we do that so that we can really impact in a rural area where it's not, the hospital might only be viewed as that's where you go when you have a physical condition, right? So how do we work together with the other ones?
Thank you so much, Diane, for that. It's important to acknowledge that the patients that we come across at the hospital come from communities. And it is in these communities, or from these communities, where we have other providers of care. We have traditional medicine men. We have what you call herbalists. They use herbal medicine. We also have those who believe that mental illnesses are associated with the evil spirits, and therefore they will prefer spiritual interventions. So as much as we are the health care professionals with a scientific basis of managing mental illnesses, I believe it's also important to acknowledge and accommodate this particular health providers from the community, these traditional medicine men and these elders, so that we don't look like we are competing. When we brush them off, then we create a competition, and they will not encourage these community members to visit us in the hospitals. But if we can understand their values, because I believe they have reasons why they believe that if I use this particular medicine, I use this particular approach, then this hallucination, for example, will go away. So as much as we have a scientific basis, I would really believe that if we are to compromise and understand them, accommodate them, then they can be willing to listen to us, and we can now establish a cooperation or a collaboration whereby we have the scientific approach in managing these mental illnesses, and we also have their approach. That way we can clear the competition. To add on that, on what Emmanuel and Matilda have said, there is also the issue of attitude change. We need to change the attitude both in the community and in the hospital. It's sad to note that as much as we have trained medical professionals, there exists an attitude towards the mentally ill. An example would be a patient who has had depression or has had just a frustration out of loss of unemployment or a chronic illness, and this patient comes to the hospital. We tend to focus most on the medical approach in helping the patient. You know, like this one has taken poison. Oh, just give atropine. And then we focus on giving atropine and vital signs are stable and we discharge the patient home. So it will be better to change our attitude and look at this patient as somebody who needs counseling, yeah? And we try to find out, why did this person take this poison? Why did this person take this particular step? And that way I think we can boost the mental wellness of the community. And just to finish up on that aspect, during discharge of these people back to the community, I think we can also enhance the well-being of the community members and the patients mentally by trying to follow them up. Thank you so much.
Thank you, Humphrey. You brought up a lot of really good points there. And one thing, when you talk about kind of the staff culture changing their attitudes, I just want to say Matibabu knows how to do this, because you have done so much in the community to change the attitudes about HIV. You know, back in the day when people just would not admit that they had HIV, to now they come and get care. And then you've done a lot to change the attitudes around disability. You know, in the past, a lot of people didn't let others know that they had a disabled person in their family. And now more and more people are getting support and community, right? So this is a really important piece that you talk about, because there is stigma in the United States. So I believe there is also in rural Kenya, where just to say, you know, I'm depressed, or my mother never comes out of the house anymore since her daughter died, or, you know, there's substance abuse or violence in the home. Like having a way to talk about mental health and social issues without there being a stigma, just understanding that this is a human thing that happens to a lot of people in every country, in every place. So we're not alone when we go through something very difficult. So thank you for all that you said there. And let's see, because the students and the staff of the hospital they're going to be looking at, they're going to be in medical situations, right? What are the things that really they should be looking for, maybe according to gender or age? You mentioned poison. Matilda mentioned birth, or you know, losing a child, not being able to deliver, these kinds of things. I noticed when I was there, a woman who was told that she was no longer going to be able to have children. And I think that's a huge thing in that culture. And I don't know if there was any support or follow-up for her. I imagine there was. But what kinds of issues might come up for different ages or genders that a person should be really sensitive to, and what should they do? Humphrey, you want to go first on that?
Yeah, sure. Thank you so much. One of the common problem or common mental issue that arises is anxiety, and I'll call this hospital-induced anxiety, because a hospital is a new environment where nobody will feel comfortable. And so when they come and they are told, we have to do this particular investigation, or you've been diagnosed with this particular illness and we need to do this particular management step, then you find anxiety coming in, you know, like how will the results be, and so how much do I need to pay for that surgery? And that's a very common problem, which I may say it affects equally both gender, female and males. Yeah, the other one will be depression. depression because of the results. Yeah, the results are depressing, and so the patient is not ready to take up the results. They are in denial, and so we need to support them, reassure them. If a patient is not capable of handling the results, I believe it will be good to assess their strength first, then we give the results and in a supportive manner. Thank you.
Emmanuel?
Yes. So I think the best way to identify if a patient is going through something, we do assessments the moment, not even before you say hello to a patient, but the moment they walk in. So my advice that I would give for those that are working at the hospital is that when a patient comes to you, there's so many ways you can tell whether they're depressed, they're going through a PTSD episode or anxiety. Number one, you can tell if somebody is depressed by how they dress, you know, their mood. Mood is what the patient tells you. I am depressed. I am anxious. Affect is what you see. You know, if you work with this patient for a long time and they normally come to you and they're so happy and, you know, they talk to you, they tell you about their family. And then the following week, they come to your appointment and they're just quiet. You know, you're trying to talk to them and they barely say a word. So there's a change in mood. You know, so there's also a bright affect where, you know, so being happy and more engaged in care, you know, that is called a bright affect. You know, being more reserved, it's more constricted affect. And so another thing is observation. You know, there's a lot of intimate partner violence, honestly, you know, in the developed countries, Kenya included. And being from the western part of Kenya myself, you know, I've witnessed that. So when you do an assessment, there's physical signs of abuse that could lead to PTSD. Is there any, you know, injury? Is a patient limping or something like that? So those are things that you can see right off the bat before you even do a medical test.
Thank you so much, Emmanuel. And Matilda?
Thank you very much. I would like to add on the aspect of the traditional medicine. Working with traditional birth attendants in South Sudan, I found out that the community, they have a trust between them and those traditional healers or traditional birth attendants. So it's important to gain their trust as well and make them as a part of the solution, so that they can also, they have an impact on the community. That is very important. And also I would like to add on what Onyango and Emmanuel said. If you see something that is not normal, for example, and I use the examples of adolescent having a child, a young girl, 14 years old, having a child, and she comes to the hospital by herself. Nobody else is with her, or she's there with her parents. The boy is not there most of the time. At that age, you know, the boy continues with his school, but the girl is left with the child. That's a very important point to connect with the family and the mother as well, to help her cope with raising a child at this young age. Thank you.
Thank you so much. I appreciate everything that you all are sharing, and you could look at any slice of life. We haven't really mentioned the elders, the older people who come into the hospital. They have specific worries and potential mental health challenges as well. And so we have to be looking at all the different pieces. And I think the best way to know, in addition to what Emmanuel was talking about, is to just talk to them, just ask questions. So who's at home? You know, what's your, you know, to the girl and her family, you know, who knows if this is a rape situation, right? So they have to build some trust really early on by being present, by being caring, and then just asking some questions, you know, and we'll get further into that. But I think the family is a key aspect, and all of the questions that I'm sharing were developed by this group. So let me tell you, the next question, it just leads right into this, is why is family support and involvement during and after a hospital visit considered a vital component of mental wellness? So what advice can you give to caregivers So this would be, you know, the patient is leaving the hospital or they're there for that day and you're starting to build a relationship with the family members who are also there. How can you build a relationship and actually give the family some insight into knowing how is my loved one doing in the next few days? What do I care for them now? When do I need to call? All these kinds of questions. Why is the family important and what kinds of things might you say? So let's start with Emmanuel on this one.
Yes, so mental health or just treatment being a holistic approach, you know, the family plays a big part. We always often think that when patients are discharged back home or when they're sick, you know, it's an individualistic battle. No. And in mental health, there's what is called behavioral activation therapy. So what this means is that finding things that patients enjoy doing, you know, because when we find all of us, you know, when we do things that we enjoy doing, we feel happy and we feel cared for, and when we interact with the people that we deeply care for, you know, we feel included and part of care. So what patients' families can do, number one, just, you know, acknowledge what their loved ones are going through. Number two, they can also find activities that reduces isolation. For example, in the case of depression. Number four, you know, also care at home, you know, either financial or nutrition or exercise, you know, things that can actually help improve the mental status of a patient. So I'll leave some for the other team members.
Great, thank you. Matilda.
Yes, thank you. I think Emmanuel said a lot of things that are very important. And this is an advantage actually for our communities in Africa, because we live with a multi-generational family. Most of the time there's a grandfather, there's a grandmother, and there are children. And this is a great thing because we can educate the whole family. The student, the nurse, or the social worker can educate the whole family, and they can take turns to help the person who is affected. If there is an amputation, for example, or somebody went to the hospital because they took poison, they lost their job, the whole family can rally around and in different times help that individual.
Thank you. And is there, Humphrey, is there also a role for looking to make sure the family has support? Because sometimes when there is you just mentioned amputation, Matilda, and I'm just thinking about, you know, especially if that person is the caregiver on the family, this could have a huge impact on the whole family. So what kind of, you know, awareness should we have about being a caregiver and now taking care of someone all the time when before you had time to do your work and now you have this extra thing, or your own emotional challenges while someone else has the brunt of the trauma? Do you know what I'm saying here?
Yeah. Okay. Family, as Matilda and Emmanuel have said, family empowerment is very important. And when we have a member of the family who has a painful, maybe a chronic condition, maybe an amputation, the way they've said, then that can bring a lot of pressure and psychological destabilization and a lot of changes in the family. And I think it's the role of, it's holistic, but the medical staff should put the family close right from the time the patient walks into the hospital, work with them, empower them, and empathize with them, make sure that they know that the medical member knows what they're going through. So, and then during discharge, and especially for mentally ill patients, it's important to ensure that the family understands what might trigger this person to relapse back to the mental problem. So back at home, the medical team may not be there. So we need to educate them on being able to spot or identify precipitating factors or trigger which may make this person go back to the initial stage and then repeating the cycle, you know, hospital, home, hospital, home. And maybe to summarize on on what they said earlier, what tends to happen is that mentally ill patients are assumed to be not useful in the society, and that can really cause more trauma. So it will be important to engage the family in making this person feel useful in what we call occupational therapy. So what do they like doing? Yeah, do they like doing some knitting? Do they like going to the shamba? You know, like I come from a rural setting where farming is a very common activity. So let them be involved in day-to-day activities to make them feel useful, and that can really be important. Thank you.
Thank you. You bring a really, really important point. And sometimes there'll be situations where it's the family can support, and maybe there'll be some encouragement from hospital staff and instructions and follow-up, etc. But how do you know when a nurse or a doctor or a student even is working with patients? How do they know, like, this case really needs to have a referral to a social worker, a specialist who's going to be visiting the home, who's going to be talking to them more, who's going to find resources for them? We now have a social worker. I think we might have two here at Matibabu now. How would they determine which cases are to that level or not? If we're all part of the team, we have our specialists who can take some of the cases and work more deeply with them. What are some of the ways that that could be determined? And what are some of the sure cases, like this should be reported, this should be reported? Who would like to go first out of the panelists? Just raise your hand. Humphrey, I can see you do. Go for it. He's leading.
All right. There's what you call, in mental health, there's what you call mental status assessment or mental status examination. So this is a systematic, standardized tool that we use to determine the severity of the mental status of the patient or the mental illness the patient is having. For example, suicide, a suicidal patient. It's possible to assess a patient who is likely to commit suicide and separate this patient from that which may not commit suicide. So that way, through the assessment scales we have, the assessment formats we have, you can be able to differentiate that patient that you can handle based on your basic skills in counseling. And you also know that this one will need a referral and probably should be put on watch so that we don't miss out on a patient, we let them go, and then they commit suicide. Yes.
Great, thank you. Emmanuel, what else should be a trigger for a referral?
Yes, so when you assess a patient, there are three things you want to look for. Number one, grave disability. And number two, danger to self. Number three, danger to others. And so a patient might come to the hospital with psychosis. So psychosis pretty much means that, you know, their reality with the world, the world is altered. And so if their safety is compromised, where, you know, they're endorsing, you know, as suicide ideation, then, you know, not just their lives is at risk, but also a domino effect of like the families, how is, you know, it might also impact their family, either on a cognitive or just a social aspect. And also another thing is that the thought part of mental health status, the thought content, actually the thought process, which, you know, a normal patient, and just normal is probably not the right word to use, but a patient should present to you with, you know, linear and organized thought process. You know, they're able to know where they were born. They're able to know, you know, what the families is. They're able to know where they are. So if you talk to a patient and they're just going on a tangent, or there's a tangent means they're talking about this and running to that, and the next minute they're over there, or they're just circumstantial where, you know, they talk to you, but then they're all over the place, but then they come back to whatever. So there's some cognitive impairment that is in that. So on a safety standpoint, you want to refer that patient as well for further evaluation and even care.
Okay, thank you so much. And Matilda, what are some other issues that you think should automatically, in a hospital setting, have some follow-up from a social worker?
Diane, I'm going to just add on what you said on the elderly. Sometimes mental illness and also dementia can manifest as physical illness. For example, it can, the person, the old patient will get a UTI, and sometimes it's very difficult to differentiate between depression and dementia in these elderly patients, and that's important for referral for further to a psychiatrist or to further investigation, and probably they need to be treated right away instead of discharging them home.
Mm-hmm. Thank you so much. Yeah, that's great to bring out that roundness. And I think we were talking about this yesterday, and also I remember a conversation with Marianne Van Dam about this, that when a person dies, often that is something that we should say, then we might need to do some follow-up and visit that family, especially if that person is a child, and especially connecting with the parents, and especially the father. And the concern that I heard there was that often in our society here, and I believe in Kenya too, there's avenues for women to share their grief, and sometimes it's more difficult after the initial happening or event and support, like the funeral or whatever, for men to share their grief that continues for a long, long time. And so they might take it out in other ways. And so this is something I'm experiencing personally right now. I recently lost my nephew, and it was due to a mental health challenge that he was having with anxiety. And he received medication from the hospital, and he also was, because he was having trouble with anxiety, he also took non-prescribed medication, right? Drugs that he bought. And this is something that was kind of a new thing with what was, really changing our country, and I believe Kuala as well. And that is, in COVID, especially with young people, there is a isolation that's happening, and there's an unsurety. They used to kind of know, well, maybe I'm going to do this in my future. Now they don't know, what are they going to do? Are they going to go to school? Can't get jobs, And so substance abuse is on the rise. And I think that it's really important that we also just ask about the family condition. How is it at home? Emmanuel, you mentioned yesterday, a lot of times men have, pressure about work and job and taking care of the family. Women do too, So, really looking into some of the issues as well that present themselves because of COVID and because we're isolated. And I would like to say, before we jump into the questions from our audience here, is that what I was concerned when we were talking about this, mostly to staff and students who don't have a mental health clinic down the road that we can send people to, like, what can we do? And what I know from my own experience in these last weeks is that people want to isolate. When grief comes or when something happens, sometimes we isolate. And it's really in being together and just care. Kindness, the kindness of a nurse who listens, the kindness of someone who goes to visit the home and brings food, and who remembers, who tells a story and asks about that young person who passed, or about that elder who passed, who asks questions and just spend a little more time. It makes a huge difference. And there actually can be wonderful healing and love and support during these times, if we keep joining together. So I just thought I should share that too, because I want to make sure that we're looking out for young people, and that we're looking out for substance abuse as a way that people kind of self-medicate, because the doctors aren't noticing that they're depressed. So they find a way to take care of it themselves and drink more, or use some non-prescription drugs and these kinds of things. So I think that's what the president of Kenya was talking about as well, is we need to be alert that we have more and more mental health issues and less services. So we all need to learn, what can we do? So let's move on to the questions from the audience. And I think Esther was telling me that there's a couple students that really want to ask a question. Esther, you want to just tell me their names, or so that we know who to start with?
So I think Mr. Humphrey can help with that.
Who?
Yeah,
Okay.
Mr. Humphrey, yeah.
Okay.
we
I
have.
thought there's somebody was dying to ask a question. Why don't you go ahead and just call their name, and if that person unmutes themselves, go ahead and ask the question.
Yeah, we have students. I'm happy to see our students represented here. I can see we have Vera Liz. Vera Liz, you can ask a question. Agisu, Ogada, feel welcome. Yeah.
So just unmute yourself and ask the question. Vera, we can see you.
Hello, good evening. My question is, can the mental status of a patient in the community affect their health-seeking behavior?
Yes.
And if yes, how can we address this?
It's a great question. Who would like to take that? Just raise your hand, panelists. Emmanuel's on it. Thank you.
The answer is yes. And this is how. So let's say there's a patient in the community and, they're struggling with depression, for example. Depression affects mood, and it also affects motivation. When we are motivated, we're highly likely to gain access to, buy food, go do things that we like doing, seek out medical support. If somebody is unmotivated and they have mood issues, they're just getting out of bed alone is difficult. They don't get enough sleep. So when you don't get enough sleep, physically you're just exhausted. So it's not because they don't want to access medical services. It's because they just physiologically their body is slammed. So a patient may just decide to just sleep all day. And so by doing that, they limit access to the care, the medical care that they're supposed to.
Thank you. Another question.
Good morning, good evening. So my question is, as nurses or nurses to be, what measures or strategies can we put in place at the community level in order to prevent the mental illnesses from occurring? Thank you.
Joy, great question. Prevention question. How do we prevent mental illness? Matilda, you want to take this one?
Hello, Joy. Thank you.
Hello.
That's a great question.
Thank you.
We deal with stress on a daily basis. And if we are not able to cope with that stress, this becomes a problem. And I think the nurses can work, I'm not sure how it works in Kenya, but in South Sudan, there is community health workers. These are people from the community that get instructions or awareness from nurses and other healthcare professionals. And they are the ones who go into the community and speak to the community members, and they can raise awareness in the community. If there is anything that is happening that is out of the norm, they can refer that person to the healthcare facility. Thank you.
Thank you, Matilda. That's great. And Joy, just as a person who works a lot with youth and young people, I know that one of the things that helps with prevention is peer mentoring. And as a student, Joy, other students will listen to you, and younger students will listen to you. If you go to a high school and you start a peer mentoring group, they will listen to you. And they will open up about what's happening in their life. One of the worst things is when a person has no one to talk to and they don't share what's happening, or they think they're the only one. This is one of the most helpful things for me, is I realize many people lose their children, lose their teenagers all over the world all the time. I am not alone. And a lot of the things we go through, peer groups can help with that. And there's training. I know that Dan Ogola and Matibabu have led a huge peer mentoring training And maybe there should be one for mental health as well. But you could lead that, Joy. They'll listen to you, right? They listen more to a student? Yeah?
Yeah.
That's right. Cool. Thank you. Okay, next student. That was a great question.
Okay, the next question. Okay. Hello, everyone. I'm Winnie.
Hello.
Okay, with the current COVID-19 pandemic, there is increased possibility of mental pressure and mental breakdown among the medical staff. Okay, what are the most likely mental problems to arise, and how can this be addressed?
Great question. Okay, let's have Humphrey take that one because it's maybe unique to the area.
Okay, thank you. COVID-19 has affected everyone, and it's good to look at both sides, the medical team and the hospital professional personnel and the community. So the most common problem that is happening even right now is PTSD, that is post-traumatic stress disorder, because COVID-19 is a novel disease. It's a new disease, we've not seen it before. And seeing patients who are healthy and they are losing their lives, as a healthcare personnel, it's quite traumatizing, because we tend to bond with our patients, and then you lose your patients. When you go back home, you are really depressed. Then there is another issue of stigma. Stigma to the medical team, stigma to the nurses, the doctors, because the community or the nations across the world know that this medical team are taking care of COVID patients, and therefore everyone is isolating them, keeping off from them, and that can really affect the medical team. In the same way to the patients who are suffering from COVID, everyone is, most people are calling them COVID cases, a COVID case, yeah, a COVID case, and or COVID victim, and that can really be traumatizing. I would rather we call them persons suffering from COVID-19, because that can really make them feel, yeah, they are people. They have COVID, but they are people. So the best way to help this kind of situation would be to support the medical team. They need to be really supported. They need to be made to feel loved. Their family members need to be encouraged so that they feel like, we are together in this particular fight. Otherwise, they'll really feel isolated, and that can cause depression and other harmful effects of depression. Thank you.
Thank you so much. We'll continue with a few more questions. So we'll take a couple more from students and Kenyans, and then we will open up to others here in the US. Another person want to ask a question?
Hello, everyone.
Hello.
Yeah, I would just want to contribute on just to what Humphrey has said about medical workers. What's happening in the clinical setup, the medical staff are overpressed because the COVID-19 is really affecting the region. How we can address the pandemic or the mental health is by engaging the health workers in some physical activities to relieve pressure from them. We offer some counseling to them so that we don't get so many of them get into the mental health. So that's all that I wanted to contribute about. Thank you.
Thank you so much. That's a great question brought up, and that is, what about the staff? And there's a couple ideas that were shared there: physical activities, getting together. Any one of our panelists want to add anything to that?
Yes, and so if you look at it with COVID-19, there are two variables. So there's providers, there's also the patient. You want to think about the financial challenges that are associated with that. And so the healthcare workers, especially, back in the rural Kenya, because there's also not enough PPE, personal protective equipment. So with that, there's just already an exacerbated level of anxiety and the flight or fight mode. Am I going to get it? Am I not? And so the exercise that you mentioned, things like relaxation, and just also the family actually supported, because it takes a village, it takes a family, which is part of the greater village to achieve greatness. And so with the patients as well, the mental aspect of care right now with economic challenges, some patients might actually need the services. They might come to the hospital, but they don't have the financial capacity to pay for the services that are there because the economy is shut down. And so understanding the challenges, the psychological and the mental health challenges that might pose actually to their care, both short-term and long-term, it's also really huge as far as preventing mental health cases from either going up or reducing.
Terrific. Thank you for sharing that. And at this time, unless there's one more student or Kenyan medical professional or partner who wants to jump on, we'll take a question from our US audience.
There's a question from someone in the chat that's Kenyan. You should check the chat.
Okay, not the one from Dan?
No, there's from somebody named Zoe.
Oh, Zoe is not Kenyan, but she's got, yeah, she's from Afghanistan. She's my mentee, but she has a great question. So Zoe, are you there? Do you want to just ask it? Or you want me to ask it online? Zoe?
Just go ahead and ask it. I believe they don't have audio.
Oh, okay. So Zoe said, at what point in one's medical state does one need to consider taking medication to help with depression or anxiety? And could medication be completely avoided? So depression or anxiety, at what point would you take medication, or should you avoid it completely? And I want to add Norma Bosini's question, is there this kind of medication available in rural Kenya? So I think Humphrey needs to take that one because that's very personal to the state there of Ukwala.
Okay. The medications for anxiety and the depression, they are very much available in Kenya. I think they are available everywhere. So we have anti-anxiety drugs, benzodiazepines. We also have antidepressants that we give to our patients in Kenya. Yes, but then we don't manage depression using medications alone. Just like as we said, that we use collaborative or holistic care. So psychotherapy, counseling, and then we just add an additive that is the medication. Yes.
Great, that was a really good question. I think some of the other questions that are in here were, oh, this is a good one. Margaret Haig, would you like to ask your question live or you want me to read it?
Well, I can ask it live. I guess my question really has to do in part with how the community responds to a person who's fully psychotic, not just depressed. How are they received, and is medication an option if a person is psychotic?
Again, Humphrey, I think this one should be yours.
Yeah, okay.
Talk about this community.
Talking from experience, especially in the rural community in Kenya, Kenyan rural communities, community response to psychiatric illnesses and especially psychotic conditions is very poor because many members living in the community are not aware about pathophysiology, the processes that are involved in the head here that really lead to a psychosis. So they tend to associate psychotic illnesses with myths. They have a lot of myths and misconceptions about psychosis. So from our setting, you find that those illnesses are associated with things like witchcraft, like someone is jealous about my, what I'm doing. So they tend to respond in a negative manner. And that's why we come in to create awareness, mobilize the community, and educate them on the scientific basis of these psychotic conditions. To respond on medication, we have, when they come to the hospital, let's say if we enhance community services and we create awareness and the patient come to the hospital, the way we manage psychosis is that we do antipsychotics, we also do psychotherapy, we also do family therapy, where we have to sit with the family and educate them on this particular psychotic illness so that when the patient goes back home after recovery, they don't they don't go through the triggers that made them feel sick. Yes.
Thank you. Thank you. And one more. We'll take one more question.
Got a question.
Okay. Thank
Hello.
you.
Yeah, this is Kenneth.
Hi, Kenneth.
I hope I didn't miss this, but I normally like thinking in terms of a framework where what I mean is that in Kenya, I'm aware that there's a policy framework that looks at the Kenya mental health policy, that is 2015 to 2030. And my belief is that from that we can derive, especially the aspects of the community approach or interactions around the area of mental health, and more so in the rural communities. And my take on this is that, for example, you find that we have less than 100 consultant psychiatrists in Kenya, serving a population of 45 million plus. And there are less than, I would say, 500 nurses trained in psychiatry. So you're looking at a picture where there is those factors that bring into play mental health issues like the social, economic, demographics, the threats like coronavirus, disasters that might come in terms of floods, diseases like HIV, for example, cancer, which then builds up the whole situation about whether somebody has just a mild form of mental illness, the so-called not psychosis, it's neurosis, I think, for those who are in the field of psychiatry. And then there are the psychosis, which is larger form of mental illnesses that come in terms of, say, schizophrenia and all that. But remember again, my thinking here is that when you're working in the community, my belief is that you are serving communities that are currently vulnerable. They've been vulnerable even before COVID. The issues about income, and you remember the elderly who cannot now access better healthcare. They are more vulnerable in terms of getting COVID-19. They're not really well informed about it. They're told to wear the masks. So a lot is happening. Look at the adolescents. They can't move around. So there are these issues that I was just thinking that if you look at the policy and bring it down to the implementation and then tie it to the community and what happens, then we start seeing what, especially at Matibabu, what we can then deliberately do, what we can then partner, for example, with the Tiba Foundation and also stakeholders, which include, for example, the Ministry of Health and partners that can then help us address these things. So I just wanted to bring the global picture and also narrow it down to that mother down there, that adolescent girl in the big village, that elderly person who is most vulnerable, especially during this time of COVID-19, and the aspects of then mental health. Thank you so much.
Okay, thank you, Kenneth. I appreciate how you say a community that's already vulnerable, and now there's these additional challenges. and looking at the big framework. And this is maybe a good way to tie it up. We had talked about, the question is, there's an increasing need for mental health support, and yet very little of it exists. So I do want to ask one final question to the panel, and that would be, if you're a student or you're you're someone serving in the hospital, and there is no mental health professional assigned to the hospital, what do you do as a person, both personally and also, you can't take on the whole world on this, but also who do you talk to in your organization to say, this is needed? Like, who do you approach? Especially if you see someone in danger, but even just, this person is at risk for a mental health issue. Matilda, would you like to take that one? And then let's go to Humphrey. And then
yes,
we'll close up.
That's a very good question, Diane, and that's the most of the African communities face that issue because there is no specialist psychiatrist, just like what Kenneth said. In South Sudan, there is, I believe there's one psychiatrist for the whole country, and mental illness is not an issue. So the best thing to do is for a student to, if I were a student, I would talk to the nurse that I'm working under, or bring it up to Humphrey or the other nurse. Sorry, I forgot your name, Esther. I'll talk to my direct, like what we say in US, the chain of command. I will speak to the person who is above me so that we can raise the issue from the community up. Maybe there's somebody has a solution. And as students, you are the eye of the community. You can report what is happening in the community and bring it up. Maybe somebody will have a solution for that.
Terrific, thank you. And Humphrey, what about you? These are your students who now are going to be much more aware of this. What do they do when they become aware of a patient or a family member of a patient that they think might be at risk for a mental health issue?
Thank you so much. First of all, the curricula in the Kenya medical training institutions incorporates a topic or a unit on basic counseling skills. All medical training, all medical courses in the Kenya, be it nursing, clinical medicine, medicine, and others. So there's a slot of counseling or psychology in each unit, and during the training, all of them are taken through that. So first of all, I would encourage them to use their basic counseling to spot this person needs care. And then depending on the severity of the mental issue at hand, empathy is very important. Empathizing, that is letting this person know that you know how they're feeling, that you are in that shoe. You can put yourself in that shoe and you can experience what they're going through, because it feels so nice. It brings a curative factor when someone tells you that they know what you're going through. And then they can use their basic counseling skills to offer counseling. They can't just say, okay, I'm going to refer you. You need to show this person that you can give something. There's something you can give to help them adopt to this particular situation. So give some basic counseling, and then look around the department. There could be somebody who's more experienced in handling such matters. So I would encourage this person or this student to attach, like promise this person, there's somebody who knows what you're going through better than I do. So I would like you to meet him. I would like to attach you to this person who will help you walk through this particular situation, and you will find yourself strong. But if there's no person with experience within the hospital, then I will suggest and preferably connect or link this person to a specialist. So like in Kenya, we have medical counselors, as professional psychologists. So I'll have to see to it that this person has been safely delivered to this person. Yeah.
That's terrific. Thank you.
Thank you.
And Emmanuel, anything else you want to just say to close the panel today?
Right. So that is a good point, Dan. And so as students, sometimes it's always just natural for us to think that somebody's going to solve something over there. You are the last line of defense. What that means is that Emmanuel can write an order and it will pass through a long line. The last person to give this medication, whether a nurse or a student, you are the last line of defense. What do, can actually save this patient or just, make things go south. So what I'm suggesting is that you already know so much as students that sometimes we limit, our creativity by wearing this big hat of, I'm a student, you already know so much. So be confident in that. Number two, when patients come to the hospital, if somebody has a chronic medical condition and they come to the hospital, there's a high likelihood that they have a psychiatric component or comorbidity. So what you could do immediately, prevention is better than cure. Number one, if somebody has a chronic medical condition in Kenya, economically they're struggling. The little that they have financially, you can help them with budgeting. If they're really, stressed out and just anxious of how am I going to pay for this? I have to take care of myself. The basic thing that you can do is help them with budgeting and also providing just the education around this condition that they are going through. That in itself is huge because we don't have a lot of, resources in Kenya. And so often at time patients they just all do this or do that and without, the knowledge. So those are the basic things that you can do right now to help solve mental health issues in Kenya.
Thank you so much, all of you. And I know that at Matibabu in particular, there are assigned social workers. So you can actually go find the social worker, bring him in to the bedside, introduce them and just say, this is someone who I really respect. And, I've just gotten to know this patient. And, I think you guys might want to talk for a few minutes and just make it happen, right? If you have a person, just help it happen because that person might not be in the hospital very long. They can go check up on them later, but it's nice to have that connection if they meet the person. But like Humphrey and all three were saying, it's the concern and the empathy and listening and asking questions. Sometimes they're quiet, so you have to ask them, right? And just sharing understanding and love. They're not alone. And how are you? And I care about you. I'd like to know how you're doing. And that kind of concern is healing in itself. And they'll be more likely to take your referral to some kind of support or referral to medication or your budgeting or whatever, if you've built that kind of connection there. So I think I just appreciate all the questions that we've had. And I want to personally thank all the panelists. I've really enjoyed getting to know you and all of the students and others who asked questions. Thank you for those great questions. But I want to have our special person here who is Esther Weary, who's the assistant principal for the college. She is a specialist in community health to close us out for today. Thank you.
Okay, thank you, Diane. Good morning, everyone. Good evening from wherever you are watching from. So I would like to say thank you for this great experience. I believe it has been a learning experience. We've had so much from this interaction. So from our to our CEO, Mr. Dan Ogola, CEO Matibabu Foundation, we say thank you. To Diane Dodge, the Executive Director, Tiba Foundation, thank you for making this thank you for making this happen. Then for our panelists, we appreciate you coming forward to share the knowledge with us. I believe we'll also have an opportunity to share it with others. Then to our audience, we appreciate you creating time to be with us, join in, give your input, stay, listen. And I believe everyone is thinking it would have taken longer because there's so much, knowledge is never enough. So thank you, and we value your input. We value you creating time to be with us. And I hope we can have many such interactions in the future. Thank you.
Thank you, Esther. So I will go ahead and leave the Zoom on for a few minutes because there might be some students who want to wave at each other. But as far as officially, we are now closed. Thank you, everyone. I really appreciate you. Thank you. Dan Ogola, you're the best. What a wonderful community you've created here. Thank you for your idea in the chat. Do you want to explain that to everyone about the Happiness Council?
Thank you so much, Diane. I just wanted to say something, or rather make a comment.
Sure.
I wanted to propose that probably we consider self-care as a topic to address the mental challenges brought about by COVID. Probably Onywera and Humphrey may consider a discussion on self-care. Otherwise, this is a great thing. It can lead to us coming up with a committee or an initiative on mental health within the community.
Yeah.
So thank you so much. I have written my comments to thank everybody. And I'll continue thanking all Diane for your effort and bringing these changes. I'm very proud of you.
Oh,
thank you so much.
Well, thank you all. It's been so much fun. So I hope to see you again soon. And again, thank you, Humphrey and Emmanuel and Matilda and each person who was here. Really, really appreciate you. And I hope you have a wonderful evening. We've got our day to face. So thank you. Thank you, Dan.
Thank you so much, Dan.
Thank you, James Abuti, too. Really appreciate you.
All right. Bye-bye. I'm out.
Okay. All right. Bye-bye.
Urima Bear.